So your first question, how can parents ask the help of teachers or school managing difficult behavior?
The question is for teacher Cesar.
Okay. Hello, good morning again. So for asking the help of teachers or in the school level for managing difficult behaviors. So what I would recommend, usually the OTs or the parents could provide the recommendations in writing to the parent. And you could also have, what I did then with some kids is that we set up ETC so that we could also listen to the teachers and on why it's difficult for them to implement the behavioral strategies. But the general strategy when it comes to the school level is that it has to be more of a group level first, a classroom level type of implementation for managing behaviors. So that means na what we want to prevent is ma-feel ng kid natin na parang sinisingle out siya or meron siyang parang special treatment bale from the teacher. It's regardless of whether it's assistance or parang in terms of using the reinforcement or parang yung system niya bale in the school. It's better if it's at a classroom level muna. So that means kung ano yung reward na plan for your kid, it could be implemented all throughout in the class. Or if, for example, if your child needs the movement breaks, the sensory breaks, or yung movement bale, hindi siya for your kid lang. Of course, later on, your child could, as what Ms. Tina said earlier, can take and request for that need. We could teach them to communicate to the teacher. We could teach your child to communicate to the teacher their need to go outside, maybe ask or go to the back of the room to get the movement that they need. But what you could start muna with the teacher is that they could incorporate yung movement activities bale during class or during the session, or they could ask the entire class to go to one part of the room or have parang mga icebreakers bale where your child could participate together with the entire class para hindi siya targeted towards your kid. And then you could already work on grading na moving from the whole class, and kapag disruptive na talaga you'd want them to have your child pulled aside lang and then have him stay in a private space and dun lang kausapin bali yung child. Our kids are very perceptive, as I've said, dun sa social reinforcement around them. So it's not just the adults, it's also their peers. And very important in school na positive yung experience nila. And if their kids, if their classmates could see na parang may ibang treatment, regardless if it's positive or not, parang it could also raise questions on the other kids in how they, and also parang raise questions on how they also interact with your kid bale. So ang mangyayari, you'd want na private muna, especially if it's a negative reinforcement, di ba? Parang it's a general rule na for one negative comment, you'd want to pair it with 7 positive comments with your kid, just to build, especially if your kid is very sensitive to negative criticism. So you want to parang sandwich that one negative criticism with the positives then that you notice. It also works not just on your child but also on the teachers and you as well, na madalas kasi we put in the intervention kapag may nanonotice na tayo na negative behavior with our kid, and that's when we come in. So parang we're always on the lookout for that negative behavior na may ganito siyang behavior. So parang yung mind mo nakaset to look for that, and we tend to ignore yung positive value on the kid. So it works well with the teacher and you as well na parang i-weight mo rin yung positives and reinforce that. Praise your kid when you observe the positive, and pag nagawa mo yan, i-sandwich mo yung tinatry mong i-target na negative behavior, give feedback on it, and then sandwich it again with another positive naman.
Thank you, Cesar. Yes, Miss Tina.
Yes, I also would like to add kasi yung mga binigay na tips ni OT Cesar are yung very practical. I'd like to answer the question also, but in terms of yung the administrative perspective, kasi kanina 'di ba sabi natin kanina, no, so we have to disclose. Magandang practice na pag nag-disclose tayo nung ADHD dun sa school, maybe we can come prepared. So magandang practice for parents to kunwari build a portfolio of our children para lang mapakita dun sa school sino talaga yung anak natin. Maybe it can come in the form of ano yung reports from the DevPed, from the therapists. And then let's also add something personal, yung things that would allow our teachers to get to know our children. Kasi minsan, kailangan silang unahan para, kumbaga, maganda kasing ginagawa to at the start of the school year so that whatever happens in the middle of the school year or during the school year, kung merong mga situations, alam mong kahit paano hindi ganun yung feeling na kalaban si teacher na parang just always out looking for mga mali or yung mga points na kailan siya nag-misbehave. Gusto natin magpartner na tayo with the teacher right away. Ally dapat ang tingin natin. So we can be preventive also with our approach. So yan, we can introduce our child to the teachers. During parent-teacher conferences, pwede rin pag-usapan na. So, dahil ganito yung anak ko, ganito yung tendencies niya, o madalas siyang tumatayo, madalas siya mag-interrupt. Ito yung mga ways na pwede natin matulungan yung anak natin. So, it really is also trying to build a community and a support system early on. So, yun. Thank you.
Thank you, Miss Tina. Naalala ko lang din briefly yung experience ko sa school. Yung lahat kami, ano mo yung dati may white, yung ginaganon yung eraser sa chalk. Tapos tas isa-isa kami pinapaganon, tapos kukuha ng chalk sa baba. Tapos yung pala, later on ko nalaman na technique yun para matanggal yung energy. Kasi yung iba sa amin may ADHD, pero hindi ko alam sino sa classmates ko. So, technique rin pala yun before to... Anyway, nag-react lang ako sa sinabi ni Cesar. Next question natin for Miss Tina. As an educator, how might a teacher address the elephant in the room? Example given, when the learner presents ADHD symptoms, pero it seems that the parents do not know or are in denial.
Okay, wait lang po. Basahin ko yung may follow-up na this is because my kid had it, was presenting. Okay. Sige. Well, I think two things, dalawang concerns yun, yung hindi nila alam, tsaka in denial. Those are two very different situations. So, yung kung hindi mo na nila alam, so meaning, tama ba yun, ang suspect ni teacher na may ADHD yung estudyante. Pero yun nga, hanggat hindi na-diagnose, wala tayong kasiguraduhan. I would like to siguro just put things into perspective muna. I'd like to go back to yung discussion kanina ni Fiel about how to how children with ADHD get diagnosed. Sabi niya kailangan 6 months yung consistency ng presentation ng symptoms, which means tayo rin as teachers, we will also have to make sure na aligned tayo dun sa, kumbaga, hindi natin pinapangunahan yung diagnosis. Of course, di ba, as teachers, we all know we're not supposed to diagnose, but we do get to develop that eye for sino yung mga parang kailangan ma-assess ng DepEd. So we just make sure first that you follow the timeline. If you're kunwari, if this is a new student, tapos sa first quarter pa lang kayo, then that is too early to tell. That is too early to say na merong ADHD yung bata. Kasi again, remember, it has to be 6 months consistent na observation. Unless itong batang ito ay, kunwari, hindi na siya bagong student, naging student na siya in previous grades, and then napag-usapan na ng mga teachers in the past na merong ADHD, parang merong observations, then I think that is the only time na we can present. And that's why, babalik ako dun sa, kailangan natin ng paper trail and we have to be able to document properly. Kung parent ka, dino-document mo yung mga, kunwari, the reports of the therapists, etc. Kung teacher ka, dapat ang report mo would be anecdotes, ang dino-document mo should be anecdotes or mga situations, incidents na nangyari within your time period. Kung advisor ka, make sure to talk to the subject teachers, and then try to consolidate, get them also to document. I know it's tedious, especially for DepEd teachers, kasi alam ko ang dami-dami talagang ginagawa ng teachers. Minsan wala ka na talagang oras para gawin ito. Pero um, kung yeah, if you want to be how do you call this, careful. And ano rin to para rin meron kang backup, para pag sinabi mo dun sa parent na ma'am, ito kasi yung mga incident, then you can it will be easier to break the news or the information to the parents. Ako, ang style ko, at lagi kong sinasabi sa teachers namin before when I was still an administrator, kung sinasuspect mong may ADHD yung isang mong estudyante, pero masyado pang maaga sa school year, then just make sure that during parent-teacher conferences, you talk about the behavior. Not necessarily sasabihin mong you think may ADHD yung bata, pero dapat pinapaalam mo na dun sa parent na meron ka nang na-observe. So parang yun na nga, it's still parang laying down the paper trail. Yun talaga siya. Para maayos, para by the time na okay, parang feeling mo, nakalampas 6 months na, ganito pa rin. Sinabi ko na sa parents, tinanong ko na sila anong pwede nilang gawin, anong pwede namin din gawin sa school, pero wala pa rin changes. Then it becomes parang easier to say na I think we have enough reason to ask for a developmental assessment. Yun. Ang importante, meron kang hawak, meron kang pruweba, and that would eliminate yung ideas dun sa parents na baka naman di mo lang favorite yung anak ko, baka hindi ka lang magaling. Meron mga ganong parents, I have to say, na ganun yung thinking nila, teacher, baka hindi kasi magaling yung teacher, kaya ganyan ang thinking niya. So para ma-dispel lahat yung mga ganong klaseng thoughts from the parents, equip yourself with enough proof na kailangan siyang makita ng developmental pediatrician. And then, for those who are in denial, unfortunately, wala kang magagawa as the teacher. Kasi that's something that is beyond our control. We cannot naman din change our way of teaching just because hindi natin makuha yung cooperation ng parent. So, basta tayo tuloy lang dun sa ginagawa natin. We still will try to be as inclusive as possible. And one other thing, sorry. Kung this is about accommodations and inclusion. Kung nag-disclose yung bata na kung nag-disclose yung parents na yung bata ay may ADHD, that is the time that you can accommodate. Meaning, pag ang ibig sabihin ng accommodation, learning accommodations, nag-a-adjust ka ng pamamaraan ng pagtuturo without changing or watering down the level of the topic. So hindi mo pinapadali yung topic, iniiba mo lang yung ways of teaching or yung delivery mo. So kunwari kung yung bata ay ADHD, nahihirapan magtapos ng written homework or written exam, baka pwede mong bigyan ng oral exam. Parang gano'n. That is an accommodation. O kaya bibigyan mo siya ng mini deadlines para mabuo niya yung buong requirement and then hindi siya malilate. That would be an accommodation. You cannot accommodate kung hindi nag-disclose si parent. Kasi pag nag-accommodate ka dahil feeling mo lang may ADHD, dahil nakikita mo, nahihirapan siya, pero wala pa siyang diagnosis, or hindi nag-disclose si parent, you can be accused of playing favorites. Tatanungin ka, bakit ganyan ang treatment mo? Bakit nag-assume ka na may ADHD yung bata? Bakit hindi mo ginagawa sa iba? So you want to be very careful. You accommodate only when there is a disclosure, but if your attack is more inclusive, meaning tanggalin mo yung barriers altogether. Sabi nga kumbaga sa buffet, lalatag mo lahat, bahala yung bata mamili kung ano yung gusto niyang pagkain. Parang ganun sa ganun ang idea ng universal design for learning in a school setting. So you will teach a very different You teach in varied ways, hoping na kada turo mo, kada pamamaraan mo ng pagtuturo, meron kang nare-reach na bata na may iba't ibang needs. If you are inclusive, you don't need the disclosure of the diagnosis. Kasi ginagawa mo sa lahat. Okay? Pag accommodation, dun lang sa bata na merong disclosure. Pero kung kaya ako mas gusto ko talaga just be inclusive. That way we don't have to deal with yung hindi sinabi hindi na diagnose pag yung mga ganyan. Inclusive, it will help not just the child, it will also help you as the teacher. Sorry, ang haba ng sagot ko. Pero yun, I hope that answers the question.
Can I
Thank you.
add lang din? Yeah. To along po on the therapist side of things when it comes to the diagnosis. Before I go to that, I agree din po talaga with the group, yung sa class with the inclusive learning, kasi even with the interventions po for school, especially for example for reading or writing na interventions for kids with ADHD, minsan kapag ginagamit din po siya with other students naman, they also benefit from it. So usually when you present it that way, teachers are also more open to applying it. And the parents din bale, the difficult part lang would be the cost talaga, especially if you need more materials, which is like yun yung isang ano talaga parang barrier for that one. Pero aside from that one, yun. I-add ko lang when it comes to the diagnosis part, usually what happens, yung approach ko with the parents, I think mas mahirap on the teacher side kasi yun nga, parang they didn't come naman for the diagnosis or in denial. Pero when they come to therapy kasi meron silang na-experience the problem and they need help for it. So even with that one, in that case, meron pa rin parents na they come in to therapy with the expectation na magbibigay ka ng ibang observation to counter yung observation bali ng doctor. So merong doctor na nagbibigay ng diagnosis, pero even with that one, with the diagnosis na, they still want another opinion na magsasabi na wala talagang ADHD or kahit sa ibang condition yung anak nila bale. So with that one, in-explain ko na with the parent na we're not allowed to give a diagnosis, but even with that one, I use a more informative approach. The same thing with what Phil did earlier na pinapakita niya yung behaviors or observations that you need to give the diagnosis. So ganin yung actual list na yun, I've already used it with the parent na I show to them na ito yung mga criteria that the doctors would use para magbigay ng diagnosis for a child with ADHD. And then, if you observe this with your child, you need 6 lang, and then isa-isahin namin valid during the feedback or during the at the end of the session, and titingnan ng parent yung list mismo, and then if they observe it, magche-check siya bale, and then we're gonna say, oh, you need 6 for this one and 6 for this one. Kasi I've experienced parents na they encounter these problems with their kids, they just don't want the ADHD label. Parang may ganong type pa rin na yung sa stigma with in the Philippines na parang kapag may label lang yung anak nila, they already assume the worst for their kid just because the kid has a label. So yun yung ina-avoid nila even if they themselves also encounter the problems na na-observe ng teacher. So what we do is that since with ADHD naman, it requires 2 settings and also the 6 months. So you could also parang have the parent observe the child more. So you could tell your side na I'm observing this with the kid, and usually the doctor would need 2 settings. So you could, if you observe this at home also, ito yung na-observe ko. So you're not pointing out na your kid has this condition. Ang ginagawa mo lang bali, you're giving information, informative approach lang. It's on the parent's side na to parang nasa kanila na yung ball na if you get the diagnosis or not. But I've done my part to tell you na ito yung behaviors na na-observe ko with the kid in the session, or it could be in the class. And then if you observe it in class, maybe we could consider po having the DevPed visit again. And then I could write up a report to list down all the behaviors I've observed with the kid. And usually I've had parents na rin come back, and then sila na yung mag-ask na, I think my kid has this. So yun. So it varies. Pero ang ano ko lang dyan is that I start working lang with the problems that they complain about, and then I see to it na parang may growth process yung kid, but the parent also has their own growth process, bale. So parang the kids growing, the parents are also growing into accepting the diagnosis.
We have a question yan na ayaw niya makilala eh. So I'll ask for her na lang. Okay? So because of his ADHD, my kid would have outbursts of anger when he is frustrated. Parang familiar yan. I often tell him that it's okay to feel angry if that is how he feels. But I would also tell him to express it in a proper way, which actually I really don't have a concrete idea how I could explain to a 10-year-old child. So how to teach a child to express anger, feel angry properly, and understand that all feelings are valid. Mga super malaman yung mga natin questions natin.
So, in summary, ang question ay 10 years old siya and how to express anger as a 10-year-old na in a safe space.
Hello, ayan. For that question, I think the talk on mental health now is really focused on yun, emotions being valid, and also like you feel emotions in reaction to certain situations, and yung emotions natin we view them kasi with the parang atmosphere now with mental health online is more of like you have this emotion, it's valid, and parang wala nang action towards the end, bale. So it should be complete. Personally, I view it as all emotions are valid, but not all behaviors are valid. Okay, so all emotions are natural reactions of our brain. So it's emotions natin, they're protective measures of our brain para magbigay ng information on us on the risks bale in the environment. So for example, anger is an emotional reaction to something that could potentially harm you. That's why blood rushes to your, di ba may physiological effects din siya bale because it's meant to protect you. So with anger, it's meant for you to fight back. So that's why blood rushes to your hands and feet, and it pushes you through action. Anxiety pushes your, parang it makes you freeze, and then nag-increase din yung sweating mo, all the blood rushes to your heart, and then it makes you freeze to give you time to process bale what to do in that potentially risky situation. And then si sadness naman, depression, it drains parang it lowers your energy levels kasi if you're sad, especially in situations where you're grieving or you had a situation of loss or parang a death of a loved one or a breakup, or it could be something na parang change bale. So parang it lowers your energy kasi since you're grieving and you don't have the energy to run or fight back, it makes you stay at home. So parang evolutionarily, these emotions are meant to protect us. So yung view lang natin now is that emotions are parang negative, like you shouldn't feel sad. You have to control, you manage yourself para hindi ka maging sad or hindi ka maging angry. So that's why we have to look at it na since evolutionarily important siya for us, ang naging problem lang is that in an evolutionary perspective din, yung brain centers natin for emotion develop later. Nauna siyang mag-develop before our frontal brain, yung cerebral cortex natin bale. So that's why yung executive functions natin, they're a lot harder to develop than our emotional centers. Okay, so that's why we have to develop yung executive functions, the frontal circuits of our brain, yung that's where the inhibition control is, yung impulse control, yung executive functions, yung decision making. We have to develop them. They're a higher level cognitive skill that we have to enhance and develop in our kids so that they could control yung emotions natin with our kids. So what happens is that these emotions are valid, they're automatic, but we have to train our kids in such a way na yung higher centers natin, yung executive functions, they would be able to control this one kasi yung emotions natin, okay, even yung automatic thoughts natin, they're automatic, but it's within our control to it's within our control bale to manage them in such a way that we can express them, we can communicate them in a parang healthier way, in a more medyo parang socially acceptable manner. So with that one, with kids, we go back into the rule where we have to make it concrete, and concrete and visual. So we've shown kanina yung angry meter. We have the green for generally calm, then we have yellow, orange, and red. So we use those colors muna. And then the best way for it is that we teach our kids when they're calm. Kasi when the kid is already like agitated and angry, it's not a teachable moment. So that's something na very important when you work on emotional regulation strategies with your kids. So parang preventive siya in a way, but also you're exposing your kids to potential situations when they would feel these emotions so that when it actually happens, they're prepared, they're already aware of it. Okay, so parang that's why it involves yung, for example, with kids, you want to make it visual and concrete. So you want to show them, it starts muna with, as I've said, yung pati yung, di ba, yung heartbeat, the sweating of the hands, it includes the facial expression, the body posture, you could feel it. Okay, and that's why important din na mag-start with emotional regulation before your child could develop empathy to other people. They have to know themselves muna. And they know how they feel these emotions, so that when they also see these emotions in other people, they also know how to empathize better. So with this one, yung sa pag-communicate bale, the first step that you have to do would be to identify muna the emotions. It's parang a process siya of where you have to help your kid identify muna when they're feeling it, and then giving a name for that emotion. Kasi ang general guideline din for that one is you have to name it, tame it when it comes to emotions. So it's hard to manage that emotion kasi a lot of times our kids would say, I'm angry, I'm angry, I'm feeling bad, I'm feeling parang ganyan lang. Pero there are different levels to anger. Iba si irritated, annoyed, frustrated, angry, raging, mga ganyan na levels bali with your kids, and they have different strategies towards it. So kapag physical aggression or yung may mga hurting na ng property, usually the general approach for it would be to retreat. So since we're focused on anger now, di ba yung parang yung the way it's developed is usually triggers. So parang trigger, and then you blow up. Parang ganun yung mechanism ni anger, right? So that's why you have to step back muna. Even for us, adults, you'd want, di ba may mga situation na mag-walk out, I need a walk, I need to that's why generally you need to be defensive in driving kasi a lot of people use driving as a means to calm down. So that's why common yung mga rage, di ba, rage driving. So that's why you have to withdraw muna from the situation in places where you would generally feel calm. So that's why you need to avoid the road, you need to avoid the malls, yung mga maraming stimulus bale. And that's why we teach kids, halimbawa, in using yung calm down corners, yung deep breaths. It's an entire process of yun, identifying and then laying out strategies and then role playing before you can actually implement it with the kids. So kaya siya i-implement, is just a process of a long process of letting them know kasi marami ding times na na-achieve mo na with this kid in the therapy session, role-playing, simulation, and then when the actual comes, it's also another skill to translate it into the actual thing. So the goal lang is for you to break it down into maraming steps, introducing strategies, role-play before the actual thing.
Thank you, Cesar, sa tips. I totally agree na kailangan ng calm place. So, I guess you can put it sa chat. Ano yung calm place sa tingin ninyo for your kids na pwede nyo gawin for them? And meron pa tayong, speaking of children and parents accommodating their children's needs, meron tayong parent support group dito sa ADHD Society na pwedeng pag-usapan further ng ating membership director, si Nina.
Ayan, super thank you sa mga learnings. Grabe. But don't worry, ano yan ha? Meron din naman tayong FB Live. So sa mga hindi nakapag-notes ng mabuti, pwede nyo balikan yon, mag-screenshot ng mga slides doon. Kasi punong-puno na yung, yung notebook ko dito. Yan. And ayun, nabanggit nga earlier ni Sheena, di ba? Now we have so much learning para sa mga parents. And lahat nga kami, meron din kami pinag-uusapan on the side na adults, and then we wish na we knew this, or yung parents namin na-share to sa amin before, di ba? So you have the power, and we are inviting you to join the society. Yeah. So for more discussions like this, we saw na Grabe, nung nag-start na may magtanong, lahat na nag-relax to ask. Diba? We are very much willing to do this exclusive session for members. Ayan, so pwede natin tawagin ulit si Teach Cesar and si Miss Tina, yan, para we could really focus on these questions. And ayan, diba? Ngayong year, so half of the year, we are having this promo. So instead na 500 yung membership natin for the year, half price isa since half the year na din. Yan, para hindi magulo. So for regular members, for parents, or for adults with ADHD, it's 250 pesos na lang. And for sa mga associates naman, so doctors, psychiatrists, therapists that would want to be part of the society to help us advocate and help our members, magiging 300 pesos na lang. Yan. If you have din naman yung mga centers, schools, or institutions na you would want them to help us, yan, yours is 2.5 naman for the whole year, and for all our events, your logo will be part of our presentation. Yan. So that's our QR code, and pwede naman din i-check din later sa website. We'll be showing it then. And ito, for our support groups, yan, if you want to see more of Miss Tina, and marami pa siyang mga ang tawag doon, mga alagad, yan, na mga facilitate sa mga concerns ng mga parents, our parent support group is bakit dalawa tong adult support group?
Sorry.
Okay, dahil may ADHD tayo,
Yes,
ayan, natural lang talaga
ADHD.
yan.
Pasensya na po.
Sige. Unahin muna
Parents
natin
yung
yung,
isa. Ayusin ko
unahin
ngayon.
muna natin yung adult. Okay? Yan. Sa
Live
adult,
edit tayo.
makikita nyo ako lagi dyan. It's every second Saturday of the month. Check na din sa website for the registration link. Yan. Nandun na yung for August. Yeah. Tapos limited slots lang yan siya. So, register for your session. Meron tayong 1 o'clock and meron tayong 3:30. Yan. For parents. So, I'm sure sasabog to parent support group. Ayan. So, nandiyan din si Miss Tina. It's every first Saturday. Wait, sige. Sige. Ayan. So, it's every first Saturday of the month. Ayan. Makikita lahat yan sa website natin, okay? So, may 8:30 to 11:30 sessions. Ito yung exclusive for members. And meron naman tayong 2 to 5 p.m. Ayan, open yan for everyone pa. And meron din tayong ito, pa-advocate din and pa-invite sa mga kids nyo na teens. Kasi yan, para ito yung nila, yung safe space nila. Minsan kasi pag yung teens nasamahan ng teachers, ayaw na magsalita. Pag nasamahan ng adults na parents, ayaw magsalita. Diba? We want na, okay, meron din tayong designated for teen support group. It's last Saturday naman of the month ng 1 o'clock and then 3 o'clock. So, same yung schedule ng adults and teens. Yan. Yung parents, yung merong morning and afternoon. Okay. Next slide, please. Yan. So, be part of member there. If you want to be partners then and help support us more, yan. Nasa website sa lahat. And next slide, please. Ayan. So again, thank you for our advocacy partners for this event. Nasaan na yung natin? Yung mga social
And,
media.
sorry. Wait lang. Thank you na rin sa aming partners din sa Future Achievers Play and Therapy Hub, NeuroDev Coach John, Rose Aligada, and Bong Pacifico T. Yes. Yan ang social media
Ayan.
channels.
Okay, pwede pa screenshot. And I believe sinishare din naman kanina pa sa chat yung website natin. So, adhdsoftfield.org. Pero Sheena, I think meron ka pang mga question.
Yes.
Oo.
Thank you sa ating
okay.
intermission.
Sige, intermission lang ako. Kasi nakita ko na super dami questions.
Pwede
Meron
nating
kaming
ituloy
support
ang
group
discussion
para
sa support group.
focus tayo doon. Oo.
Like,
Okay.
calling back again sa ating, stop share muna ako, ating speakers. Yan, si Cesar, si Tina. Keep the questions coming hanggang 12 ang time natin. Pwede ba tayo mag-extend for a bit? Yes. Siguro a few more minutes. Hanggang 12 lang kasi originally eh. Pero sige, let's choose a question. Ayan. For Miss Tina, regarding naman sa from Ria, ang question niya ay, how can, kung meron lang daw isang teacher per classroom, how can they realistically support children with ADHD in the class? Especially for the younger kids na may individualized monitoring na kailangan, which may be difficult if yung class ay 30 or more classmates. So, anong support kaya ang pwedeng hingin natin sa government to ask help for teachers who are already burdened with so much work?
Okay, I cannot speak for the government. Although yung aking talk ay on yung mga laws or national policies that we have, no, but I think being realistic about our situation, even though it is in nasa batas siya, no, na kailangan talaga ma-support ng mga eskwela natin yung mga bata with ADHD, among others. Yung reality natin is kulang na kulang talaga yung mga tao natin who can help. Kunwari kulang yung teachers in schools, kulang nga yung schools natin, di ba? Tapos and I think private or DepEd schools, this is a common problem. Na again, siguro yung lang natin, no, we have to communicate. Going back to my kanina, no, yung tips ko on how to advocate. Maybe we can make sure lang, no, that we make our needs known to the right people. That would be my first suggestion. So if you're a teacher and then working in a DepEd school or a private school, tell your supervisor para lang, and then make sure it's put in writing, so it's clear na meron kang ganitong need. Eventually, yun nga, madali kasing balikan yun at madaling sabihin na, oh, nag-lodge ako ng ganitong need or ng ganitong complaint. So, that would be the first step. Pero yung how to survive, no, on a daily basis, it depends siguro on the kind of class that you're teaching. I'm guessing you're either in or your teacher in an early grades, in the early grades. This is from Miss Ria Garcia. Maybe siguro early childhood yung class, or maybe it's non-graded. So merong iba-ibang mga baka iba-ibang age groups din. But ako, going back to my experience also as a SPED teacher, the best way to manage it na mag-isa ka lang is really to help equip your students so that they can manage themselves. So for example, yung gusto ko yung explanation kanina ni OT Cesar about how you can break down kunwari yung teaching how to handle emotions. Pinapakita mo dun sa bata, no, ano yung mga grades kumbaga, or yung what do you call that, yung levels na pwede na kailangan para hindi lumala yung situation. So parang you nip it in the bud. So ganun din with handling children. Ang sa akin you teach your children so that they can do things by themselves, and sometimes you can also teach them to help you. So kunwari yung assisting, pulling in kunwari students to assist you in class, that I think is a helpful tip. In DepEd, I have spoken to some teachers, some supervisors who say that sometimes they invite parent volunteers in. So ang nangyayari, merong extra hands to help them out. I don't know if that will work for your setup, because I don't know kung DepEd teacher po kayo or private school, pero yun, pwede kasing isang option yun. You can maybe usually naman sasabihin ng school, no, kunwari we don't have enough budget to pay for another teacher or for teacher aide or a teacher assistant, a shadow teacher, etc. Then you can use volunteers. So I know of a school here in Marikina, DepEd school here na yun ang naalala ko very vividly ang kwento niya. So nasa SPED center siya, 4 lang silang teachers, yung mga estudyante nila 120. Lahat ito sa SPED. So sabi ko, so paano nyo hinahati? Sabi niya, hindi pwedeng equal yung hatian kasi dun sa 4 na teachers na to, isa lang ang marunong ng sign. So yung nagsa-sign language naming teacher, automatic sa kanya na lahat ng deaf. So lahat ng iba paghahatian na namin. So ganun yung nangyayari. So sabi ko, so paano nyo minamanage? We bring in parent volunteers. So on the one hand, you have more hands to help you. On the other hand, you get to train the parents on how they can help their children, how they can manage the behaviors, so that pag uwi sa bahay, iisa yung approach ninyong lahat, and then na-equip yung parents. So I think that that is a creative idea of how you can help yourself, you can help your situation. It's also a win-win situation for both you, the parents, and the students as well. Wag lang yung ang sinasabi nila, basta yung parent hindi niya hawak yung anak niya. Kasi syempre that would have complications also when it comes to behavior. Anong klaseng yung behavior yung, di ba mas nag-act out ang mga estudyante natin, mga anak natin pag nakikita yung parent. So yun, pwedeng ganun yung merong mga I like the idea of contracts. So kung kaya nung bata, kung nakakasulat, nakakabasa, nakakaintindi ng instructions, then you can go into a contract so that alam nung bata na nandito yung mommy ko or yung daddy ko to help out. Pero pwede rin namang yun nga, you be strategic also with how to do it. So yun. I think wala na akong ibang maisip. But I think that that will help your situation also.
Thank you, Miss Tina. We have room for one final question. Dahil, yes, napakarami yung questions. So, don't worry, marami pa tayong mga activities after nito sa ADHD Society. Please follow us on Facebook para updated kayo sa mga future events natin and seminars, no? So, our final question, how do we ensure the meaningful participation of children and youth with ADHD during consultations together with other children and youth with and without disability? So how do we advocate for ADHD during consultations daw?
Hello. And so for this one, yung I'm not quite sure how many children and youth we have in groups. Usually, in my case, we add them into groups because we've already evaluated them in terms of their strengths and their weaknesses or ano yung mga areas to improve on. So yung ginagawa namin bale, I'm just giving a disclaimer lang na yun yung from situation where I'm coming from. Kasi there might be difficulties or challenges na lumalabas if like very big group na. But it's always a process na you have to meet the child first one-on-one before you let them join a bigger group. Kahit na dyad or triad lang na group or a group of 4, dapat makita mo na yung kid bale, just so you have a profile of the strengths and the weaknesses that the child has. Kasi if you have a picture already of the child when it comes to strengths and the weaknesses, alam ko yun parang nape-prepare tayo with what to expect when it comes to ano yung kailangan i-manage with this kid. But it also helps if you have a list of the strengths. So very helpful if you have that one with your kid din na parang may profile na siya of the strengths that your child has. So for example, I have kids na very they have a hard time with motor skills. So hirap sila with mga exercises, knowing where their limbs are, kung gagawa ng movement, pero they're very good with communication. They're very good with memory and sequencing tasks. And then meron din ang kids na very poor when it comes to auditory processing. So hirap sila with narratives, sharing stories, or hirap sila with expressing themselves, pero very good when it comes to structured tasks, following instructions, going from one place to the next, and then following a structure bale. So what we do is that we design tasks in such a way na itong group of kids would benefit where yung challenge for this specific task, itong group of kids yung matcha-challenge. And then mangyayari parang what you call this, peer modeling bale. So ang mangyayari, you partner them with a child or isang group kung saan strength nila yung major challenge for that specific task. So ang mangyayari, parang kuya yung role nung isang mas magaling for this specific task and siya yung mag-guide. And then, you could also add in a way na, for example, if nakaparang obstacle course siya, itong part naman na to, strength naman ng isa, and then they would help out this other person. So parang ang mangyayari, both of them would get the assistance from the other kid, and then ma-work on yung isang improvement area niya. And at the same time, in another task, parang baliktaran sila bale, so both would benefit. Pero if the task would take so long, it would mean na pwede mong ma-divide din into different sessions. So for this session, itong group na to yung mag-improve. Ito yung target area na pwede nyo ma-work on. So everyone would get to work on the same set of skills bale. And it's not a disadvantage din on the other group na parang develop na to na set of skills kasi they work on their parang confidence then in such a way na they're helping out this time. So they're so used to being the ones getting assistance. So this time they get a feel naman of giving assistance to other kids. So somehow they get a picture already. They see the bigger picture na kahit may difficulties sila, they also have their strengths and they could also help out other people. So they're not coming from yung goal ni Ina na yung goal na self-determination where we want our children to advocate for themselves, to stand up for themselves. So they have to have a good picture then of their strengths and weaknesses so that when they come to the situation na mahirap, at least they know what to use. So for example, we have kids na very strong with visual. So yun yung gagamitin natin. You could use pictures, you could use stories, you could use parang mga activities bale that are very strong on the visual side para yun yung gagamitin nila to compensate halimbawa for their difficulties with speaking or difficulties with anxiety when they come into social situations. So parang meron na kayong set strategies na pwede niyang gamitin while also developing yung naiiwan bali na developmental domain. So parang meron ka ng profile of these different sets of ito yung kids mo na kailangan mag-work on this, i-partner natin with this one para mag-benefit bale and then switch naman ng roles. So ito yung mag-assist bale in cognitive task, ito naman mag-assist in motor task. So both would benefit coming from that experience.
Thank you, Sir Cesar and Miss Tina. And napaka-rich ng... Oh, yes! May dagdag si Miss Tina.
Yes. Sorry, dadagdagan ko lang. Actually, tatanungin ko rin sana ano yung ibig sabihin ng consultations. So thank you, Sir Ranil, for for adding the context. It's on consultation on the situation of children with disabilities. So,
Teacher Tina, can I be recognized?
Yes, sir.
Okay. Thank you, Teacher Cesar. No, actually, we're facilitating activities of children with disabilities with different impairments. We have autism, we have Down syndrome, we have ADHD. Now we have the BEP, those mobility impairment. So my question is on that context. How can we ensure the meaningful, not the token participation of children and youth with ADHD? On that context. Actually, we're doing this for so long. I just want to ask you on how you do it. But actually, we've been doing consultation of children with and without disabilities. So that's the context. Maraming salamat, Cesar, Teacher Tina.
Okay. So I'll add naman po. When it comes to especially with the youth, with the older so yung sa mga obstacle course kanina, you could use it in younger kids. But kapag ka youth or the teenage level, lalo na kapag different yung impairments nila, what you could do is you could use a more of a problem-solving approach. So what you do is you come up with a social situation kung saan silang lahat merong difficulties. So you could look at a school level, a community level, or a home level, and you would discuss the difficulties bale. So I'm not quite sure if ano yung level, pero if they're already in the topical, yung parang thematic type na magdi-discuss na ng specific themes and topics bale, in a sort of like support discussion, what we do is that you could have a certain problem. So for example, ganun pa rin po, bali, you could, the good thing about it then with the social situations is that possible na iba-iba sila ng level of difficulty. So for example, you could have a situation where ang difficulty nila is making a friend in school, or you could have ordering food at a restaurant, or making a phone call, or taking a phone call, or parang looking for resources when it comes to saan sila pupunta saan sila kukuha ng help if they need to go to the hospital, or kapag may ganitong condition. So you could could have a topic for that specific session, and then yun yung magiging parang center point niyo bale for that for developing yung ita-target ninyo for those specific kids. So for example, yung question natin, yung situation natin would be about speaking in front of class. Let's say lang yun yung situation. So there would be kids na magdi-deal with anxiety, or there would be kids na magdi-deal with not knowing what to say, or yung sa memory nila when it comes to that class. And then ang mangyayari bale, you would explore on possible solutions. So ang mangyayari this time is that, di ba parang with younger kids, when we work with problem solving, usually it's like 1:1, which is developmentally appropriate din. But when you get to older kids, ang gagawin bale is that you list down on the possible solutions. So you brainstorm together, and then depending on their level, you could also work on the consequences of those solutions, and then later on choosing yung best possible solution depending on the consequences that you've lined up. So ang mangyayari lang po bale, you would give supports. For example, if ito yung specific situation that we're talking about, so you could divide na yung intervention. So halimbawa for people with motor difficulties, ito yung strategies natin. If you have problems with communication or asking for help, ito yung strategies natin. If you have trouble with ganitong cognitive aspect, ito yung gagawin natin na compensatory technique. And what's going to happen is that you get to role play next. So you could also shift roles. So for example, like speaking in front of class, other people will participate as the classmates. Siya yung mag-in front, we take turns. Or if restaurant setting, someone will act as the cashier, take turns. Or if in parang road na setting, take turns. So parang magpe-play sila bale ng different roles. Ang mangyayari, you work on the executive functions, planning, organization, you work on the communication, you work with the cognitive skills when it comes to decision making, planning, yung sa higher level bale, and then you get to role play. Tapos yung, I think the difficult part there lang is applying it in the real context, kasi depending on your program din, there are programs where you get to apply it small group into the real setting. So merong, for example, if you have a group na pupunta talaga kayo ng mall, so I have kids, for example, where you really go to a grocery to purchase, so mag-work on yung identifying the roles of people there, so identifying who the security guard is para to get help in case of a security situation, or asking for help sa parang cashiers or yung assistance there on where to find a specific object, and then actually talking to people dun sa real life na situation. So, and then after that one, you go back to the session, to the controlled na setting, and then target another specific situation naman na social aspect bale.
Yes, thanks, Cesar, for your feedback. The time now is 12:08, and I am sure busog na busog tayong lahat sa feedback inputs na Miss Tina, Fiel, and Cesar. So, may we flash again on screen ang ating evaluation survey. So, para rin ito ma-improve ang services natin, ADHD Society, sa future seminars natin in the future. So, thank you again, Miss Tina and Sir Cesar. Marami pa tayong discussions in the future, so pwede pa natin pag-usapan ng mga ADHD questions niyo sa ating future seminars.